are going to do Trach Care now on Mr. Jones. So we are going to make sure we identify my patient by checking his name band, checking your order. We are going to provide privacy for the patient. I have washed my hands. Now I'm going to open my normal saline. You're going to take the cap off. If it's been open, you're going to lip it, which means pouring some into the trash can. If it's a brand new bottle, you're going to date and time with the year on it. And also the same thing for your hydrogen peroxide.
You're going to take the lid off, make sure they're face up so that you can put them back on your bottle.
Now you're going to take and open up all of your supplies using your non-dominant hand during most of this procedure, depending if you have your sterile gloves on or not. So
and this is a sterile procedure.
So now she is opening up her Trach Care kit. Always make sure when you open something sterile, you touch by the edges only. I always used to think of it as like a picture frame. You never want to lean into that.
Take it out by the corners. And you're not sterile yet, so you can move things around if you need to.
And now you're going to, as you open your kit, you're going to take your half strength. You're going to make half strength normal saline after you have your gloves on.
And some of these gloves are smaller than others, so you might want to take, if you have large hands, grab an extra set of sterile gloves to have handy.
And now you're going to take your non-dominant hand and you're going to pour half strength normal saline and hydrogen peroxide in one compartment, and then you're going to pour only saline in the other two compartments. So half strength normal saline with hydrogen peroxide.
And all of this is sterile, so you can use both hands as of now.
You will have your 3 containers.
Now I'm going to fill my containers. So I'm going to take my non-dominant hand and pick up my saline. So now this hand cannot be used for anything sterile. So I'm going to pour saline in 2.
You're going to, you're going to do your saline, just a plain saline in 1.
And then you've got your hydrogen peroxide that you're going to put in just 1 to clean your inner cannula. You want it half and half.
Correct.
This hand is still sterile, so I'm able to get my inner cannula ready.
So now with your non-dominant hand, you're going to remove your inner cannula. You're going to take that out and you're going to put it into the one with hydrogen peroxide to soak it and clean it.
Now I have this, and you're going to, if you don't need this, you can toss it. But let's say you don't have your inner cannula to replace and you're reusing it. You're going to clean this. You have your pipe cleaner. You're going to take your sterile hand. This is going to clean the inside. Make sure you keep your hand sterile.
Make sure you inspect the cannula for cleanliness by holding it at eye level and looking through the light. Again, using the dominant hand.
So now I'm cleaning my inner cannula in saline. You're going to get
non-dominant hand.
You're going to get the excess off. You're going to clean the inside with your pipe cleaner. Just the inside gets cleaned or dried.
Do not dry the outside. Now you're going to insert the inner cannula by grasping the outer flange and inserting the cannula in the direction of the curve. Lock the cannula in place by turning the lock, if present, into position to secure the flange of the inner cannula to the outer cannula. Now you're going to remove the dressing, peel the gloves around it. After it's removed, discard, and then we will put new gloves on.
And I like to put my trach tie back on just so it doesn't fly out while you're working with the patient if you can. If not, then you'll want to hold on to your patient's trach the entire time. So if this is dirty, you take your sterile hand, put it into your normal saline, the clean one. You're gonna clean up underneath.
Clean around the flange and discard, and you're gonna do it probably multiple times.
Make sure you get all the extra exudate off. You're gonna clean the plastic piece as well, anything that has that extra crusty or exudate on it.
Then you're going to apply a sterile dressing. Place the dressing under the flange of the trach tube. While applying the dressing, ensure that the trach tube is securely supported so it does not come out.
So now I'm going to hold it. Now that I'm done cleaning, I can use that sterile hand. You want to make sure one side is attached at all times. So don't unhook both sides together. The trach tie portion of this, Mrs. Koya will read, but typically you're just going to have these Velcro straps in facilities. If it's different in your facility, you'll learn that when you go to do trach care.
A trach that is unsecured can lead to accidental, being extubated, which is a medical emergency. And you should always have your extra trach at the bedside. If someone's not available, you're not going to remove the old ties until the new one is secured. The one strip method you're going to cut a length of tape at 2.5 the length needed to go around the client's neck from one flange to the other. You're going to thread one end of the tape into the slot and one around the patient's neck, keeping them flat and untwisted. You're going to thread the end of the tape next to the client's neck through the slot from the back to the front. You have the patient try to flex their head a little bit. You're going to tie loosely the ends with a square knot by placing 2 fingers under the ties. And this again is the one strip method. Make sure when you are done, you document everything that you have done. Make sure the patient's breathing and check his O2 sats. Possibly, you should probably listen to his lungs again to see if it's cleared.
And that's it for trach care.